mediators of the effects of canagliflozin on heart failure and CV death in patients with type 2 diabetes. You point out a number of biomarkers here that can be used to sort of predict mediators of the effects. Can you sort of take me through how a clinician can use the results of this study when creating or refining a treatment algorithm for a patient?
Yeah, the mediation of analyses are really exploratory analyses. The main take-home message is that canagliflozin reduces heart failure, and that's the randomized analysis. That's a higher standard of evidence. What the mediation analyses do is go beyond that to try and generate hypotheses on the mechanisms, on how canagliflozin might be reducing your rates of heart failure. And so we look at the effect, we take something that we know that is effective, canagliflozin on heart failure. We then look at the effect on canagliflozin on other intermediaries or biomarkers that change, and then look at the post-randomization effect and pull all that together. So they are observational analyses. But what they showed was that part of the effect correlates with the effect on hemoglobin, for instance. Similarly, the effect on albuminuria and on systolic blood pressure. Sorry, it is a little early in the morning here. And so what that means is that part of the mechanism might be mediated through those actions. Now, we know that albuminuria, as we were just saying, correlates with the risk of heart failure. So possibly there's a mechanistic, a causal effect there. What it does, and that remains to be proven in subsequent studies, but what I think the message for a clinician is that if your patient has albuminuria, that's even more important that they get treated with canagliflozin if your goal is to reduce rates of heart failure. The other really interesting finding we found was that part of the effect appears to be mediated by hemoglobin. Now that really just pushes the question on a little bit more. Is hemoglobin perhaps a surrogate for volume? When you have a diuresis, maybe your hemoglobin concentrations are measured higher. We think from the work we've done and the work that other groups have done that it might be more than that. It might be the effect on oxygenation and on demand in the kidney and possibly demand in other organ systems, including the heart. All that remains to be seen. And really what this study does is direct two groups. The message to other scientists, I think, is that these are mechanisms that need further research, and that we need to have better understandings on the mechanisms of how canagliflozin works. But the message to our other group, the clinicians and patients, is that while that work goes on, we can be reassured that canagliflozin will reduce rates of heart failure, and that these markers, I think, pick out particular populations, people who, particularly who have high blood pressure or who have high levels of albuminuria, might be the populations who most stand to benefit.